Welcome to Canadian Justice. I'm Christine Van Geyn, and today I'm joined by Dr. Brian Day and Dr. Shawn Whatley. Dr. Day is an orthopedic surgeon, the founder of Vancouver's Cambie Clinic, and a former president of the Canadian Medical Association. He has spent decades treating patients while also becoming one of Canada's most prominent voices in the debate over healthcare reform. His legal challenge to BC's restrictions on private pay healthcare sparked one of the country's most closely watched constitutional battles over the future of Canada's healthcare system. Dr. Shawn Whatley is a family and emergency physician and one of Canada's leading voices on healthcare reform as well. He's a past president of the Ontario Medical Association and currently serves as a Monk Senior Fellow in Health Policy at the Macdonald-Laurier Institute. Canada has a government monopoly system providing healthcare to patients, and many of our political leaders fear making any changes to that system. But change and innovation are necessary when the current system fails patients. A 2005 Supreme Court case called Shawn concluded that access to a waiting list is not access to healthcare, and that Quebec patients' charter rights were being violated by a government system that prohibited patients from choosing private care when the government system left them waiting. Dr. Brian Day at the Cambie Clinic launched a similar legal challenge, but the BC Supreme Court strangely did not reach the same conclusion, evaded the Shawn decision, and now patients in Quebec have more rights than patients in the rest of the country. And now the BC government has come after Dr. Day and the Cambie Clinic for costs, $1.6 million. Dr. Day, Dr. Whatley, thank you so much for joining me today. I want to begin with you, Dr. Day, in this case. Why don't you tell me about the most recent development, the government's decision to come after you to pay their costs for this litigation? Where do things stand right now?
Well, as you say, the BC Appeal Court has upheld the lower court judge's decision to award an additional $1.6 million in costs to the BC government. I might add that this case went on for a long time, years, and we already paid. We were forced to pay $800 a day every day in court as a cost to be there. But so we've already contributed a lot, and obviously the Canadian Constitution Foundation has helped us a lot by helping us fund that challenge. But what's remarkable is that this appeal court has upheld the lower court's decision, but the same court, the BC Appeal Court, with 3 different judges, had previously refused to grant the government costs of the actual appeal of the case. Mm-hmm. So this is, this inconsistency speaks to the fact that court decisions are not actually based on an objective analysis of the law. They're so influenced by the personality of the individual judges sitting on the case. And judges won't want to hear this, but perhaps it's time we replace them with AI.
Now, Dr. Day, one of the things that's strange about the costs case to me is often the government doesn't seek costs when it's public interest litigation, which I think this was. So why do you think the government's doing this?
Well, the BC government in particular is clearly not in favor of a Charter of Rights and Freedoms that restricts their ability to control and dominate the public. And that's what this is about. An opposing, very highly respected constitutional lawyer who was an opposing lawyer in our case, like he was against us, the late Joe Ave. He was adamant that valid challenges for charter rights, not only should no costs be awarded, and he's on record as this, but the government should be paying the cost of both parties, because otherwise there is no, you need to be fabulously wealthy to fight for your charter rights, and that's not what's the point of having a charter that only wealthy people can challenge under, and as of now, no individual or small group can possibly challenge for their rights under the charter unless they have great wealth. It's a David and Goliath issue for sure.
It really is. Yeah, 1.6 million. If people do want to help support the fight and this punishing cost that the government's imposing, they can visit the ccf.ca/donate, where they can learn more about the case and donate to support it. That's all the time we have. We got to go to break. Welcome back to Canadian Justice, where we are discussing healthcare innovation in Canada and a legal challenge to Canada's government monopoly healthcare system. Dr. Brian Day and Dr. Shawn Whatley are both leading voices for reform in Canada's system. Dr. Whatley, I know that you closely followed the litigation that Dr. Day brought in the Cambie case. I know that you support reform. Is there a particular patient or experience with Canada's current system, Dr. Whatley, that convinced you that our current status quo isn't acceptable?
Well, I think it was a collection of patients, and actually, it was my friends and neighbors. I finally grew so embarrassed of someone saying, "Oh, by the way, I was just in your local emergency department," and I would cringe because I was chief at the time. But one particular patient stands out. It was a wonderful gentleman, retired executive. He had a bit of dehydration, needed to be admitted for a day. There were no beds. He was in a hallway, and getting rehydrated causes you to need to go to the bathroom. And so he got the attention of a nurse scurrying by. She's very, very busy running down the hallway. He says, "Excuse me, I need to go to the bathroom." And she stopped, looked at him, and said, "You have a diaper." So he was telling me this story and he said, it was just so undignified. He said, they were all wonderful people, but that was so undignified. I've never had to use a diaper as an adult. And so that stands out. I mean, many, many stories, but that particular story, it seems like a small issue, but the indignity of the situation, we don't capture that in a statistic.
Yeah, I mean, I read your book, When Politics Come Before Patients. I think it opens with the story of a woman having a miscarriage in an emergency room bathroom because she couldn't
Yeah.
get care. Dr. Day, same question. Is there a particular incident that made you feel, now is why I want to bring this challenge to the system?
I don't think there was. I just think there were so many patient experiences. I was aware that thousands were suffering and many were dying on wait lists. I mean, one of my colleagues was the head of the Canadian Pediatric Society, and he wrote an article that 2/3 of children across the country were not being treated within the safe benchmarks. And of course, children, I cynically thought it's because they don't have a vote. That it's terrible that the system wasn't treating children, but doctors and nurses were not being allowed to work. I mean, back when I last checked, there were 1,000 nurses from Canada commuting and be working at a single Detroit hospital. And we say there's a shortage of nurses. It's because we've created this dysfunctional system. I gave a talk at the Canadian Orthopedic Association. Afterwards, I had lunch with 9 recently graduating orthopedic surgeons, 6 of whom were being forced to go to the United States to work because they couldn't get a job. They couldn't get operating time. And this speaks to the strategy of governments across the country. And this was alluded to in the BC Appeal Court, that governments are purposefully rationing access to healthcare in order to achieve fiscal sustainability. That's a direct quote from a court that ruled against us. But they said in ruling against us that it's not our job to change the health system. That's the job of government. So we're not going there. And so I think there are multiple reasons, but the fact that we are in a crisis right now is evident to everybody, I think.
Dr. Whatley, that we talk about wait times, but I think what people watching this need to understand is what the consequences are for those wait times. From the perspective of a physician, what are the medical consequences of leaving someone waiting on a wait list for a surgery for an extended period of time?
Well, the biggest one I think that hits the news all the time is the addiction crisis, the opioid epidemic in Canada. For a long time, we said pain was your fifth vital sign, and so we need to treat everybody with pain. Well, when you have someone in pain for multiple years waiting for a joint replacement, guess what? They tend to get hooked on their narcotics. So that's the biggest one that stands out.
Dr. Day, anything you want to add to that in 30 seconds about the medical consequences of
Yeah,
waiting?
there's a major, the medical consequences are obvious to everyone. The patients get worse as they wait, and the surgery and the treatments get more difficult. And the economics are incredible, the economic cost. But if they die, like 4,500 BC patients a year die on wait lists,
Yeah.
multiply that by
Yeah.
10.
It's
If they die,
terrible.
the
We've
government's
got to go to
money.
break, but we will be right back. Welcome back to Canadian Justice, where we're discussing Canada's government monopoly healthcare system and how, people support a public healthcare system, but in many cases, this system is failing patients. And what do you do when you're left for an extended period on a wait list not being treated? Well, Dr. Day brought litigation to challenge that status quo, to try to have innovation in the system, to bring a challenge that really was very similar to a challenge that was successfully brought all the way to the Supreme Court in Quebec. But for some reason, the BC Court of Appeal reached a different conclusion. And I do think, Dr. Day, even though you didn't win this case, which I think you should have, it has changed the public conversation about healthcare in many different ways. Maybe you could talk about what type of conversation you think we need to be having about this issue.
Well, I think it is. As you've alluded to, it's much worse now than it was during the Chowley thing of over 20 years ago, and even when we started. But I think that politicians have shown weakness, with the exception of, the hope. I think it's very hopeful what Danielle Smith is doing in Alberta, where she's obviously looked at what other countries that outperform us are doing and is starting to introduce some reforms there. I think one of the things that Canadians don't understand and need to is that in Canada, it's the lowest socioeconomic groups that have the worst access and the worst outcomes. So it's not doing what the politicians claim it was supposed to do. And the argument about, private options are for the rich. If nobody who's rich suffers. They go down to the Mayo Clinic, the Cleveland Clinic, or other places in the US. So the rich, let's forget that rich argument. We are looking at our system, and we have to improve it. And I think the trouble is, at any one time, maybe only 2 or 3% of the public are waiting for healthcare, and unless it's you or your loved ones, until it hits home. But now, I think with the current crisis, it's starting to affect more and more people. So maybe more people are being educated on what this crisis is.
Dr. Whatley, there is this change happening in Alberta. Maybe you could expand on what exactly the Alberta government is doing right now. And it looks like they're maybe going to be experimenting with a little more private care. Can you explain what's going on and what your take is on it?
Yeah, well, first of all, kudos to them for trying something. And also kudos to Prime Minister Mark Carney for not shutting it down immediately. So I think both sides need congratulations on this. They're trying to allow some flexibility for specific procedures during specific hours performed by specific physicians. So I say specific 3 times in a row to let you know the government actually has great amount of control over how this is going to look and who's actually going to be able to get care. But I'm cautiously optimistic that maybe we'll be able to see a little bit more choice for patients and a little bit of increased access for patients who want to get treatment and care outside of the public monopoly.
Yeah, Dr. Day, is there anything you want to add on the specifics of Alberta's reforms? Do they make you a little more optimistic as well?
Well, yes, I think it just takes one province. This one of the potential advantages we have in Canada is that there's room, because we have so many provinces. Let's try it in one province. It's not going to devastate the whole country. And I think Alberta are leading the country and will show that this can be done and it will help people. And, the other thing which I obviously have talked about in the past is the lowest socioeconomic groups can still access private healthcare as they do in Switzerland and Holland and Australia, where the government pays the premiums or subsidizes the premiums so that low income groups can get treated. I think everyone who is in the lower income group should be subsidized to get private insurance. So there's a bit of competition for the state monopoly. And that's and I think can't be underemphasized. We are the only country on the planet Earth where private healthcare is unlawful as mandated by the state.
I think it's not allowed in North Korea, but I don't know that we want to.
Not true.
Not true?
It's allowed in North Korea, allowed in Cuba. I'm an honorary member of the Cuban Orthopedic Association. I've seen private healthcare in Cuba. It's allowed in communist China and so on.
We've got to go to break, but we'll be right back. Welcome back to Canadian Justice, where we're discussing a legal challenge to Canada's government monopoly healthcare system and the possibility of healthcare reform. Right now, patients who are on government wait lists watch their health deteriorate and they suffer. And there's a lot of pushback to anyone who says we should improve the system, we should change the system. A lot of politicians say that this is an attempt to, quote, Americanize Canada's healthcare system. Dr. Whatley, how do you respond to that pushback?
Well, I think it's a distraction. There are over 30 countries in the world that currently have universal healthcare systems. That means everybody in that jurisdiction has access to care. To make the discussion only about us versus America is a red herring. And so I wouldn't even enter the debate. There are lots of reasons why it's a bad argument, but I would try to redirect the conversation towards saying, why don't we copy some of the other 28 to 32 countries in the world that offer universal health care for their citizens?
Yeah, I mean, I would say that the Americanization of our system is the fact that we have nurses who commute to the United States to practice, and that we have patients in Canada who go to the United States to seek treatment when our system fails them. So there is an Americanization of the system in that regard, and it's something that we should, try to improve. We should offer innovation in Canada to stop that. Dr. Day, what do you think of this criticism, which I'm sure you've heard a million times, that your goal is to Americanize our system?
Well, I mean, let's face it, there is good healthcare in the United States. That's why our politicians all go down there when they need healthcare. But I mean, the last time the World Health Organization ranked health systems, they ranked Canada 30th in the world and the US 37th in the world. Well, if you're the 30th, why would you want to copy the 37th ranked country when there are 29 countries ahead of you that you should be looking at? So it doesn't make sense. And as Shawn said, it's just people who are extremists making a silly argument.
Dr. Day, you have been fighting this fight for a really long time at great personal, emotional, and financial expense. And I want to know, if you had another doctor, a young doctor, come up to you tomorrow to say, I'm so frustrated with the failings of our system, I want to fight for change, what would you say to that doctor?
I would say the most important thing is to educate your patients and the public, because doctors are not, held in the regard that they used to be. I don't think governments are listening to doctors. They listen to the polls and the public. And what's interesting is there are like 15 or 20 polls over the last couple of decades, and they all show the public is the majority of the public is ready for this. But for some reason, politicians are afraid of those polls. Now, I think it's educating the public, because the public have to realize that no, it's not this. It's what the rest of the world does. Countries like Denmark and Sweden and Holland and Belgium, these are not right-wing radical. New Zealand, these are not right-wing radical countries. Let's copy them because they outperform us. And There is no monopoly I know of that serves the consumer well. Not one. I can't think of one.
Dr. Whatley, I'm really interested in this idea that politicians are actually well behind public sentiment, that the public opinion on this has shifted. Do you get that sense as well? And why do you think politicians are so afraid of having this conversation?
So, double-barreled question. Absolutely. Most people in the studies I've seen support a private option, fully private. I wouldn't call the Alberta option fully private, but a fully private option in the same way that we have toll highways in Southern Ontario. As long as you do not make the traffic worse on the public highways, people support the concept. As to why politicians don't get behind it, I think it's survival.
It's been a long time that this has been treated as something you can't touch. Dr. Day, do you think that's changing? Do you think we're going to see with this change in Alberta things maybe expand, the conversation get a little different?
Yes, I think it has to change because, it's now, they've always been backed up in emergencies, but now more and more emergencies are being, people are suffering when they've got an emergency and dying. And so it has to change.
That's all the time we have. Thank you both so much. We've heard today about Canada's healthcare system, long wait times, and the debate over whether patients should have more choice in how they access care. When the public system fails, Canadians should be free to seek public treatment. But you be the judge. Thanks for watching, and remember, a freer Canada starts with you.